This equation tells us how to calculate the percentage of deaths attributed to any cause. I'm going to use this to do a crude analysis of how many people are dying globally from the obesity epidemic. A paper in the New England Journal of Medicine estimates the level of global overweight to be 20% and obesity to be about 10%. Flegel et al. 2016, published in the Journal of the American Medical Association, will provide the relative risks of each BMI category. As you can see, overweight and type 1 obesity have a lower relative risk of death than normal weight. If we enter the data for overweight, we get a factor of minus 1.21%, meaning that about 667,000 deaths were prevented by overweight worldwide. We know that 10% of people were obese, but I don't have a breakdown of how many were type 1 compared to type 2 and 3. If I guess that between half and 2/3 were obese, type 1, then I get about 138 to 184,000 deaths prevented. For obesity type 2 and 3, the number comes to 508 to 758,000 deaths. If we add these up, then we get a net decrease in deaths globally, from 343 to 46,000 deaths averted. However, Lance et al. 1998 controlled for socioeconomic status and found that the heaviest 15% of participants had a relative risk of 0.94. This roughly converts to obesity type 2 and 3 having a relative risk of 0.94 in our formula, in which case 960 to 970,000 deaths were averted globally. If we analyze the US with the same data, we get a range from 82,000 lives saved to 115,000 lives lost. You may have noticed in Lance et al. That the relative risks for inactivity are insanely high. If we use the same formula to calculate the effect of inactivity, we come to an astounding 1.75 million deaths in the US alone. That's over 2/3 of all deaths attributed to inactivity. So what does Wikipedia say about the number of deaths due to obesity in the US? Approximately 100,000 to 400,000 deaths. The link that is provided also says 100 to 400,000 deaths, but provides another link, to none other than Catherine Flegel, who I cited earlier. And what does her 2005 study actually say? For overweight and obesity combined, our estimate was 25,814 excess deaths. The 95% confidence interval ranges are from minus 86.284 thousand to 137,913. To put 25,814 into perspective, this was 1.1% of deaths at the time, meaning lack of exercise is killing 60 times more people. Nowhere does Flegel 2005 reference 400,000 people dying, and it doesn't even rule out that a substantial number of lives are being saved by overweight and obesity combined. The 400,000 death statistics comes from an often cited publication that was retracted by the CDC. Flegel actually worked for the CDC, and the CDC accepted her numbers in her 2005 article as being correct. This is typical of the obesity discussion. A lot of the discussion is centered around people who get their facts from Wikipedia. How is it that some studies do get astonishingly high levels of deaths attributed to overweight and obesity? There are many ways in which we can increase or decrease the effect of obesity by controlling for various factors. Fat people in developed countries, where most studies take place, tend to be of low socioeconomic status, and people of low socioeconomic status tend to live shorter lives. Thus, if you control for socioeconomic status, fatness becomes entirely beneficial for longevity. Exercise has a huge effect on longevity, and presumably fat people exercise less, so we can presume that controlling for exercise will also decrease the relationship between weight and mortality. Diet pills, particularly in the past, were quite deadly. Diet pills are only prescribed to heavier people. No study has controlled for diet pills, but this would undoubtedly decrease the effect of overweight and obesity. Weight cycling and fluctuation has been shown to be detrimental to health. This complicates matters in a way that may exaggerate the risk for someone who has always been fat. People over 65 cannot be found to have any correlation between fatness and death. Most deaths occur in people over 65, and yet most studies look at people in middle age. This also exaggerates the correlation between obesity and death. These factors are all hard to control for and are generally ignored. Analysis that increases the correlation between obesity and death, however, are often employed. One legitimate procedure is to exclude smokers, because smoking makes you skinnier and is bad for your health. This is easy to control for and often employed, including by Katherine Flegel. Even so, overweight people still have a lower relative risk than normal weight people amongst non-smokers. The other major analysis is to control for wasting diseases. Some diseases, it is reasoned, will make you lose weight before killing you. Thus, excess weight is more deadly than it appears on face value. This gives researchers license to take out deaths of skinny people that they don't like, often taking out around 90% of deaths. No one can agree how this should actually be done, and Katherine Flegel argues that it should not be done at all. Even if controlling for wasting diseases is valid, it is surely more than counterbalanced by the effect of all the other factors that decrease the correlation between weight and death. So going off of the prima facie evidence minus smokers, as Flegel does, is surely justified. But there is a lot of studies that only alter the data in ways that will increase the consequences of heavier weights, and these alarmist studies are the ones that are often covered by the media and even accepted by the World Health Organization.